Okay, today's recording is going to cover Chapter 14, Your Future in Pharmacy Practice. So we're going to look at some different topics, including your increasing your employability, job search, and ethics in pharmacy practice, and trends in pharmacy practice. I'll let you guys read through the objectives from your PowerPoint. So we're going to start with increasing your employability. So we want to look at the career outlook for pharmacy paraprofessionals is going to be bright. So the career outlook is looking good for paraprofessionals, which is like assistant professionals, which could be like pharmacy technicians. So pharmacy technicians, of course, are gaining recognition for the roles they play in a wide range of pharmaceutical services in your various employment settings. So this just gives you a couple definitions. A paraprofessional is a trained person who assists a professional person. A professional, of course, is someone with recognized expertise in a field who is expected to use his or her knowledge and skills to benefit others and to operate ethically with some autonomy. So the professional is like a pharmacist, and a paraprofessional example is a pharmacy technician. So this is just showing you an outline of what we're going to go over. So the first one, of course, is adjusting to work in the environment, to the work environment. So you have transition, of course, to the pharmacy work environment may require some adjustments. So it is a lot to learn with the pharmacy technician's job. It it takes months, of course, to learn all the pharmacy technician duties a pharmacy technician does. A pharmacy technician on multiple occasions throughout the day will multitask, and then and it takes a while of getting used to, plus knowing all the particular pieces of the job. So when you first do your internship, don't feel bad that that you maybe have forgotten some of the branded generic name drugs. It does takes a good while, and I'm talking months, to remember everything with the just with the 1 year training you've had. So tips for adjusting to the workplace are going to be attitude. So have a positive one, and remember that you are part of a team. Uh, Cooperation, of course, is extremely important. So always make sure you have a good attitude. And there are going to be times, especially with retail pharmacy, customers are going to come in and they're going to be, very sick or not feeling good or ill or have problems. They've sat at the doctor's office for hours and they have to come there and wait about 10, 15 minutes, and it's kind of irritating to them. So even though um, they may be very nice people, but just in that moment of time, they may be having a bad day. So you just have to always still have a good attitude, even when the patients sometimes may not. So reliability, of course, be on time, available, and dependable. So unreliable pharmacy technicians do not keep their jobs very long. It is very important to be on time. It is a very busy pharmacy. Most pharmacies are very busy, and even showing up 1 hour late can put them behind extremely a large amount of time. So if you are constantly late to work, or you don't show up, or have bad excuses, they will get rid of you because they need people there that they can rely on to be there on time and come into schedule when scheduled. So make sure your employer um, of course, can count on you. Okay, so tardiness can affect others' work schedules as well as your own. So tips for adjusting to the workplace, of course, accuracy and responsibility. So you develop work habits that ensure accuracy. So you want to keep your attention on the tasks at hand and always double check everything you do. Okay. Relating to your supervisor, be respectful of your supervisor's experience and knowledge. So ask them how they prefer you to address them, such as like doctor or Mrs. or Miss, say Miss Goad or something like that, or Dr. Goad. If you have, of course, tensions between you and your immediate supervisor or your pharmacist, you must take positive steps to lessen them. So, and if you have any differences with the professionals or your immediate supervisors, please discuss any differences later in private. You don't want to discuss it in front of others. So personality, of course, be cooperative, self-confident, and enthusiastic at all times. Performance, do you need to devote your full attention to your job throughout your work shift? So you want to demonstrate that you can get things done and that you can put the job first. So tips for adjusting to the workplace are continued. So questioning, do not be afraid to ask questions. If you have forgotten something or don't know where something goes, they would much rather you ask them where it goes or ask the question than to guess. Guessing can make mistakes or cause people not to be able to find products. Okay, or just to show you a couple examples. Dress, make sure you follow the dress code of your organization to the T. Not following the dress code usually can get you written up, sometimes fired. Receptivity, of course, is listen to advice and accept criticism gracefully. So if you make a mistake, own up to it. Everybody is human. People make mistakes. If you make it, just own up to it, apologize, correct it, and try to make sure it don't happen again. Etiquette, pay attention to your workplace culture and emphasize courtesy. Alliances, so forge alliances with your colleagues, but do not engage in like cliquish behavior. So you want to, form friendships or alliances with your colleagues, but you don't want to be like in a clique, okay, to where you can be singled out as that type of person. So you just want to kind of be well-rounded. Reputation, make yourself indispensable to the organization. By being pleasant to others helps you to, of course, be noticed, especially in working with retail pharmacy when you have to work with customers. They do want their customers to keep coming back, so that is a big plus in retail. Or you can make useful suggestions to help improve the workplace environment, but make sure you don't overstep your boundaries with that one. Also, you can volunteer to stay over your scheduled time. So if they're really, really behind or busy, you may want to volunteer to say, well, I can stay over an extra hour if you need help, and so forth. Luck, you can control your own luck somewhat by cultivating your alliances. Most of the big lucky breaks in life come from knowing the right people at the right time. So it is important to be nice to everyone, and because you never know what positions may open up later. So learning, um, of course, your pharmacy is, of course, always going to be is a rapidly changing field in general. So stay current with the new developments in the pharmacy practice. And some examples of these are your laws, pharmacy laws, like different dosage forms that are changing in medications and regulations. And you can do this through continuing education courses that you need to complete anyway for your end of year CEs. And of course, expertise, deepen your knowledge in different areas of the profession. So you want to become highly knowledgeable about a specialty area within your field, such as compounding. This makes you more of a worker that they would like to hire because you have specialties. So some specialties in pharmacy technician or compounding, preparing hazardous drugs, inventory control, management, also preparing IVs. Some people don't like to do that. Some people love it. So that can be also a plus as well. So reflectiveness, of course, take the time to reflect on your career path so that you can plan where you would like it to take you. So pharmacy technicians are increasingly asked to seek credentials. Credentials, of course, is just a documented piece of evidence of one's qualifications, such as a pharmacy technician licensure or certification. So as part of the pharmacy profession, technicians are expected to be qualified to perform the duties required. They use their specific skills and knowledge to perform the duties required. And they adhere to the code of ethical conduct as well. So licensure refers to the granting of a license by a state, And here are just the definitions of what licensure certification is. Certification is the process by which an organization recognizes individuals who have met certain qualifications. At WCC, you are receiving, for going through our complete program, a career study certificate in pharmacy technician, which qualifies you to go sit at the state board test for the pharmacy technician certifications. And for the national test as well. So registration, of course, generally refers to a requirement that individuals in a profession sign up with a state agency, such as Virginia State Board of Pharmacies. In Virginia, if you take the state test, then what you do is you turn around and you have to, no matter which test you take, you still have to register with the state of Virginia. So I'll explain those differences to you a little bit later in this presentation. Again, your definitions of credential and licensure, and certification and registration, what I've already been over. So professionalism and the technician certification is becoming a requirement in many states. So many states recognize the national technician certification. Other states recognize pharmacy technicians through licensure or registration. So Virginia does make you go through a training course, which you get have a certificate, and then you do have to register with the state of Virginia as well. Renewal of the licensure or registration is required in 3/4 of the U.S. states. So in Virginia, pretty much, you have to get a you have to go through a state certified program, and at WCC we have that as your career studies certificate in pharmacy technician. Then what you do if you do that, because you don't have to wait till you finish, but you can go still. The second thing you should do is pass your state test. You do have the option of taking your national test. State test is usually easier for students, and but then you can also take your nationals if you prefer it. Then you need to register with the state of Virginia, which means you do have to show them that you passed the WCC Career Studies Certificate program in pharmacy technician, and you have to show them the piece of paper where you passed your state test. Okay. After that's all said and done, you're registered with Virginia. Then you have to have 5 CEs each year to renew your license or your registration. So renewal of licensure or registration is required in 3/4 of the United States, especially and with Virginia. Some states require completion of an accredited technical education program plus a defined amount of work experience. As an example, Virginia, you have to take an accredited career. In Virginia, you only have to have the career studies certificate, like I said earlier. You do have to do 6 hours a week for 16 weeks of internship experience. Compare that with other states. Virginia is a little bit more lenient than others. Just to kind of give you an example, South Carolina, you have to pass a technical program, which is usually about a 2-year degree. They don't have a state test, which our state test is easier than the PTCB, which is the national. They make you take the PTCB certification test, and then you have to have 1,000 hours of work experience prior to becoming registered with South Carolina. So it's a little bit more pickier. The PTEC is Pharmacy Technician Educators Council, which suggests developing a 2-year associate degree standard for technician training. Some states already do that, but they are trying to develop a 2-year associate degree standard for technician trainings. If, for some chance, you graduate with a career studies certificate in pharmacy technician at WCC, 9 times out of 10 they grandfather those people in who do not have the 2-year degree, which is nice. So the Pharmacy Technician Certification Board, PTCB, was established, of course, in 1995. There are 2 examinations that are available for becoming a certified pharmacy technician. A certified pharmacy technician is a national recognized test, and it is abbreviated C for certified pharmacy, PH with lower h, in capital T, technician. So a certified pharmacy technician, there are 2 tests out there available for that. One is the PTCE, which is offered by the PTCB board, and then the other one is the one by ICPE, which we'll talk about shortly. So its mission is to establish and maintain criteria for certification and recertification of pharmacy technicians. It developed the Pharmacy Technician Certification Examination, PTCE, which has over 275,000 technicians, which is certified over that many. Again, this is just telling you definition to remember. Professionalism and the technician, anyone with a high school diploma and without felony convictions is eligible to sit for the PTCE. Okay, so you do have to have a high school diploma and be 18 years old. Okay, and and you have to be without any felony convictions, and you can sit for the PTCE. So the national test, and that is one of the national tests. So the national test, you actually do not need the Career Studies certificate from WCC if you take the national test. But I kind of warn people it is hard. The national tests are much more difficult than the state test. So it is important to take the Career Studies certificate through WCC to prepare you to take that test. And we do prepare our students to take both the national and the Virginia state test. If you would like to take the national test, you could go online, and there are some study books that are available from the APHA, I mean. Okay. So the PT is supposed to be PTCE, sorry about that, seeks to verify the candidate's knowledge and skill base. So it is comprehensive in scope. The PTCE again, I've done that again, sorry about that, consists of 100 multiple choice questions and is administered online. So it breaks it up into categories. So the scores are based on the total number of correct answers, and a passing score is 650. So there are about 80% of candidates that pass the national test, the PTCE. And this is the content within it. In the category. So one, assisting the pharmacist in serving patients, maintaining medication and inventory control systems, and participating in the administration and management of pharmacy practice. And these are the percentage of questions for each category. So category 3 would be 12%, category 2 is 22%, and category 1 is going to be 60% of the questions. The PTCB, of course, requires recertification every 2 years, whereas in the Virginia registration certification, you only have to have 5 CEs a year. You do have to have, which is every year. Excuse me, with the PTCB, it's every 2 years, but you have to have 20 hours of continuing education. If you become nationally certified, and you register with the state of Virginia, you still have to do both. Okay, so it depends on what you want to do with your career. So the technicians must earn 20 hours of continuing education credits. 19 of those credits can be in any pharmacy in general, as long as it refers to pharmacy technician's job. 1 credit, one of those CE hours, must be in law, or pharmacy law, I should say. So the pharmacy-related continuing education can be provided by professional organizations, employers, websites, or journals. Okay, with the national test, you can use college credits as well for that, as long as it pertains to the job of pharmacy. So it could be your pharmacy technician courses, it can be math courses because you do calculations, and so forth within it. So the pharmacy technicians receive notification of the need for recertification with the national test 60 days prior to the recertification date. One of the websites I like to go to that you can also get these free online at www.pharmacytechs.gov. and you have to register with them, but it is free. Power Pack. Power is P-A-K, not P-A-C. PowerPack.com. Okay, you can register with them for free to read some articles, answer some questions, and you get some continuing education credits that way. Again, that was another term to remember. I'm just kind of going through those. The Institute for the Certification of Pharmacy Technicians, the ICPT, also recognizes technicians who are proficient in the necessary knowledge skills. So they are the other company or organization that offers a national exam. So the ICPT offers the exam for certification of pharmacy technicians, which is known as your EXCPT, to test for a minimum level of competencies. Again, that's your definition. So the EXCPT is an online test of 110 multiple choice questions. It is being offered now in 50 states, and it must be completed within a 2-hour time frame, this test. It is weighted towards various topics. So you have your 25% is going to be on regulations, 23% on drugs and drug products, and 52% on the dispensing process. In the area here where you have the 23% on drugs and drug topics, that's going to be the top 200 drugs. Okay, and then you're going to have the top 100 OTCs, over-the-counter medications. Okay, the top 200 would be prescription only. So it will cover the top 200 prescription drugs and the top 100 over-the-counter medications. So those who pass are considered certified pharmacy technicians, then they do get the CPHT. If you take the Virginia state test and you're registered in Virginia, just that one by itself, you don't have the title CPHT, but you are a registered pharmacy technician. But to get the CPHT, which is a certified pharmacy technician, you do need to take the national test. In 2008, the ICPT designed a practice and math self-assessment and training manual and test to, of course, help pharmacy technicians prepare for national certifications. If you do not pass, you can retake it 4 weeks later. Again, that was a term to remember. So what is the difference between licensure, certification, and registration? These are just some questions to think about while studying. And why are they important to the pharmacy technician? The hierarchy of your the technician positions. So many organizations have different levels of technician responsibilities with corresponding job titles, such as Technician 1 and 2, Technician Specialist, Senior Technician. You may have, I worked for a pharmacy that went through just cashier, pharmacy cashier, then you had your pharmacy technician, then they had lead technician. So they do have levels of technicians out there. So the responsibility and pay increases as the technician moves up the company ladder, and every company will be different. So as part of the pharmacy technician profession, the pharmacy profession, technicians should get involved in decisions, of course, that are going to affect the profession. So different ways of doing that is volunteering to serve on a committee of a pharmacy organization, running for office in the local chapter of NPTA or AAPT, attending a national pharmacy convention, sharing these service experiences with colleagues, of course, can help advance the profession as well. So what does the professionalism mean in, of course, pharmacy practice? Here are a couple more questions to think about. How do professional organizations benefit the pharmacy technician? And of course you have, these are just questions to think about while studying, but you do have more explanation on these questions on page 418 and 419 in your book. So what characteristics do hiring managers look for in a pharmacy technician? good communication skills, because you're going to have to communicate with healthcare professionals and also customers as well, and work with each other, and interpersonal skills. Um, so those good communication and interpersonal skills are going to be important to interact with the patients, coworkers, and other healthcare workers as well. So ability to perform accurate and precise work. So your pharmacy technician does or will have to do some type of math calculations. They will do computer prescriptions or computer prescription entry. So you need to be able to perform those duties accurate and precisely. You need to be dependable. So employers want people who will show up for work and show up for work on time. A lot of times with pharmacy technician jobs, you do have to work weekends and nights as well as some holidays. So clarify your career goals for job search. This is just an outline of what we're going to be going over. Write a good resume, establish a network, identify and research potential employers, write a strong cover letter, prepare for the interview. So clarify your career goals. So you need to, of course, determine your preferred pharmacy setting, if uncertain, interview pharmacy personnel in the settings. And of course, consider what you want out of the job. Do you want retail management experience? Do you want experience preparing sterile products or compounding or non-sterile products? Do you want experience in ordering, inventory, and billing? Do you want to work in a community pharmacy? Do you want to work in a hospital pharmacy? You can also work in long-term care pharmacies, home infusion pharmacies, and so forth. And nowadays, I think nursing homes do hire pharmacy technicians as well to help with meds, along with doing other duties as well. So a resume is a brief written summary of what you have to offer an employee. So when you make up a resume, just remember you're selling yourself. So resume is the marketing tool. The product being marketed is going to be you. So your resume should follow a consistent standard format. If you're unsure of what one looks like, there is an example in your book on page 421. And also you can look online for free resume templates if you just want to have a template and then just type in your information. Okay, so just type in free resume templates for pharmacy technicians and you should get plenty online. Be conservative when choosing stationery and envelopes. So ordinary, opaque, color paper or off-white paper is acceptable. You don't want any crazy colors, so do not use any unusual colors because you want to be conservative. When you're writing a good resume, you do want to check carefully for your spelling, grammar, usage, punctuation, capitalization, and always have someone else proofread your resume. Here at WCC, we do have a English lab here at WCC who can look over your resume for errors. And we also have a career ready center who will help will help you look over your resume, but they will also help you put a resume together. So if you've never written a resume, I would suggest coming to the Career Ready Center here at WCC. It's located in the ARC, or the Academic Resource Center, and talk with someone down there because they can actually help you put one together. Here is an example of a good resume. It does consist of an objective, your education background, and I would add in your internship as well, your certifications, if you've already taken your test, any skills that you've learned, and your employment. Employment is where you can put your internship as well. So tell everyone you know when you're establishing a network. You should tell everyone you know that you're looking for a job. So tell people who may help you in your job search, such as teachers. Students email me sometimes, and I'll tell them, if they once I find. Sometimes some of the pharmacies will call me, letting me know that they're looking for pharmacy technicians. And if you're looking for a job, if you email me, I'll let you know once one of them approaches me. So faculty can help you. Career centers as well. Here at WCC we have that. A lot of places will call them as well. Friends, family. So just knowing people and just let people know if they may not know work in a pharmacy, but they may know someone who does, and that they person may tell them that they're looking for a part-time position for a pharmacy tech, so that it can sometimes knowing about pharmacy technician jobs is done by word of mouth. A lot of time pharmacies do not advertise the need for a pharmacy technician through the papers or anything, because usually they knows somebody that needs a job and it's certified, or they'll call schools that have pharmacy technician programs to get somebody that's already certified. In the state of Virginia, you do have to be already certified to work in a pharmacy, unless you're going to school to be a pharmacy technician. They can hire you now as a pharmacy technician. If they hire you part-time, you have 6 months to get certified. If you're working no, wait a minute. If you're working full time, you have 6 months to get certified. If you're working part time, you have 9 months to get certified. So find out the needs of potential employers. So you're doing your internship now, so many students can sometimes get hired during their internship if a position opens up and you do a good job. Also, they may not have any positions now, but later on, if they have a position that comes open and you did a great job there, a lot of times they'll call the interns first, so because they know how you work. So it is important to do a good job and show up on time for your interns or your internship. Join professional organizations, attend meetings, and network with colleagues is another way. So you want to research potential employers, of course, at your school's career center, a career library. Search web job sites for career opportunity postings. Many local hospitals also have websites that is used to post job vacancies. I know Carilion does, so that would be one good way to start. Write a strong cover letter. A cover letter, of course, is the first communication you send to a potential employer. It should highlight your qualifications and call attention to your resume. And you also want to proofread your cover letter carefully. So you want to proofread for spelling errors, grammar, usage, punctuation, capitalizations, and then also the format of it as well. So whenever possible, address the cover letter to a specific person if you know that a specific person at that pharmacy. So knowing details about a potential employer can help you assess whether the employer is right for you, and if it could also, in some points in your cover letter, help you in your cover letter or your interview as well. So you want to make sure you find out all you can about the employer before the interview. Review your research and role play an interview situation. Again, the Career Center here at WCC can help you do that as well. It is good to write up practice questions and have someone ask them to you and then you answer them. It helps you to not be so nervous for your interview, and also to helps you to prepare your answers. Eat well and sleep well the day before and the day of the interview. So also another thing to do is during the interview, you do want to follow the guidelines provided in Table 14.4, which is on page 424 in your book. So you want to rehearse answers to common interview questions, and there are some on Table 14.5, which is on page 425 in your book. So when coming up with answers to such questions, bear in mind the employee's point of view. So you always want to, when you think of coming up with answers, you want to think of what their point of view would be. What would they want? Be ready to describe past situations that illustrate your qualifications and how you handle those situations gracefully. Have your own questions ready to ask if the opportunity arises. And always, of course, follow up with a thank you note after the interview. So questions to think about while you're reading through the material are, what are the key components of a successful job search? Where can you do research on potential employers? What interview questions do you think would be most difficult to answer? The benefit, of course, of studying, well, of course, it's ethics in pharmacy practice. The benefits of studying ethics is that you internalize a set of guidelines based on a high professional standard. These will guide your decision making and actions. So ethics, of course, the ethic is a process for reflection and analysis of behavior when the proper course of action is unclear. So the ethics is the study of standards of conduct and moral judgment that outlines the right or wrong of human conduct and character. Codes of behavior. This is an outline of what we're going to go over on the ethics of pharmacy. Codes of behavior dilemmas and questions facing healthcare professionals. So ethical codes, of course, are going to be based on the belief that based on a relationship of trust between the professional and the client, meaning the patient. So the professional service is not standardized, it is unique and personal. So the patient does not have the skills and knowledge to go it alone. He or she must rely on the professional, so they must rely on the pharmacist. So the patient is vulnerable to the services provided by that pharmacist. A professional, of course, must meet certain criteria. So a professional, which means a pharmacist, must hold a specialized body of knowledge, so which enables the practitioner to perform a highly useful social function. It also helps to help patients make the best use of their medicines as well. They have a altruistic, I'm not sure if I pronounced that correctly, I'm sorry, of attitudes, of course, that influence his or her professional behavior. Of course, it is a basic attitude. It is an unselfish concern for the welfare of others called altruism. Pharmacy technician, of course, must be empathetic because most patients, of course, that come into the pharmacy or that you come in contact with are going to be ill or going to have some type of serious disease. So if it's subject to social sanction, so the trust between the society and the professional and the rewards it entails. So a code of ethics assists a healthcare professional in choosing the most appropriate course of action to handle an ethical dilemma. So when faced with an ethical dilemma in the pharmacy, the technician should ask these questions. What is the dilemma? What pharmaceutical alternatives apply? What is the best alternative? And can it be justified on moral grounds? So you want to stop and think first before you act. Okay, you want to think about these questions before you act. And if you're unfamiliar with the ethical dilemma, the definition is on the next page. It is a situation that calls for a judgment between two or more solutions, not all of which are necessarily wrong. So pharmacy technicians, of course, must recognize, accept, and apply the ethical standards of pharmacy practice. So they also must apply them when working side by side with the pharmacist as well. And there are some examples on page 427 and 428 in your book. Again, there's your definition. Here are some questions to think about. Examples of ethical dilemmas a pharmacy technician might face. And how should he or she handle them? Again, these are in your book. Examples of these questions here to help you study are on page 427 and 428 in your book. Trends in pharmacy practice can be outlined as your workforce issues, new medicines and new drug development and technologies, increased healthcare and drug cost. So workforce issues, as the volume of prescriptions rise and the reliance on the drug therapy is going to increase. So the need for pharmacy technicians will continue to grow. The volume of prescriptions is estimated to double in the next 5 to 15 years. So the they will double in the number of pharmacy technicians that are needed as well to help prepare them. So the number of pharmacists is expected to grow only 30% in that time. So there are going to be, so that need for the well-trained qualified technician is going to help bridge the gap between the volume of work to be done and the personnel available to do it will be critical. Pharmacy technicians, of course, will be needed to fill those gaps. You have increased emphasis on mail order pharmacies. Mail order, of course, is the fastest growing distribution channel based on claims of cost savings. So they use the latest, these mail order companies or pharmacies use the latest automation with the capacity to dispense 6,000 prescriptions per 24 hours in a day. So it's a lot of prescriptions. Pharmacists and technicians will be needed to oversee those operations. There is an increased emphasis on managed care. So pharmacy will be called upon to provide the best drug therapy at the lowest cost. Technicians will find new opportunities to support roles. And of course, that's going to be support roles with the pharmacist who you're going to work closely with, programs and efforts to encourage smart but inexpensive drug use. So communication, writing, and computer application skills will be needed for technicians who specialize in managed care settings as well. Increased geriatric application, so the importance and volume of medication, of course, will increase with the aging population. So that's where it gets its increase in number of the prescriptions from. So Medicare Part D will provide drug insurance to a greater number of older patients. So the Medicare Part D program is complex and can be confusing to a population that already finds navigating the internet and healthcare system difficult. So they do have some Medicare Part D pharmacy technician certifications out there available to be an expert in the Medicare Part D. Increased emphasis on home health care. So home health care is growing rapidly because of reduced cost and preference of patients to be treated at home. More pharmacy technicians, of course, will be needed to serve this industry. Examples could include like your TPN therapies. Another example would be HIV and AIDS therapy. Another example is cancer chemotherapy, home antibiotic infusions, and biogenetic treatments for autoimmune diseases. So you have growth in clinical applications. So education and counseling functions will become more important. So usually the pharmacist will be doing more counseling functions and more educational services as well. There will be more pharmacy specializations such as cholesterol control, TPN, which would be more hospital pharmacy. Pharmacokinetics is more hospital specializations. But the more pharmacies, of course, will offer specialty services in education and in management for patients who have also like diabetes. You may have diabetes specialists or asthma specialists. You may have flu shot clinics or vaccinations, and those can be given by your pharmacist as well. This growth, of course, will require increasing support, of course, from the pharmacy technicians. So increases in the pharmacy technician responsibility and specialization. Technicians will be given more responsibility. So in some states, Virginia does not, but some states allow the pharmacy technician to accept new prescriptions. Virginia, like I said, Virginia does not, but there are some states that are allowing them to take prescriptions from a doctor. Some allow pharmacy technicians to check other pharmacy technicians' work. Technicians, of course, will follow pharmacists into increasing specializations such as service, sterile and non-sterile compounding, and diabetic education. Technicians, of course, may be asked to work more with patients to assist with medical devices such as like your glucose meters, your blood pressure monitors, and so forth. The pace of innovation is increasing rapidly for new dosage forms and drug delivery mechanisms. So you have your transdermal patches, ocular inserts, and your wearable IV infusion pumps. Robotics and technology, of course, will play a larger role. So you have automated compounding, filling, labeling, and record-keeping devices. You have an increased emphasis on e-prescribing and EMR. So the use of barcoding and scanning has increased in both hospital and community pharmacies already. It is to maximize the efficiency and minimize medication errors. So the U.S. spends the highest percentage of your gross national profit on health care than any other country in the world. The U.S. is not among the leaders in the average lifespan. So and that's due to risky health behaviors, so like bad diets, lack of exercise, smoking, alcohol excess. There are 47 million citizens without health insurance. So the costs for patient care are expected to outpace inflation over the next decade. So the cost for Medicare ages of people older than age 65 are going to be projected to double from 427 billion to 884 billion by the year 2017. So patients are becoming more sensitive to the cost of healthcare and prescriptions, and pharmacy staff will have to work with patients to find the most cost-effective option. So some questions to think about while studying are: where is the practice of pharmacy headed? How do you think the role of the pharmacy technician will change? And what types of skills and knowledge will the pharmacy technician need in the future? Just some questions to think about, and I will go ahead and just make sure you do your chapter quiz off of your CD and submit it to me through email. And you do have to be online for me to get those. And also your chapter test. And if you have any questions, please send me an email. I'll be glad to help you.